and hello, Dr. Corradino.
Hello, Eli.
Um, you always say that neuropuncture is the only complete neuroscience acupuncture system. Can you please tell us what makes it complete system?
Yes, that's a great question, and I struggled in the beginning to or to have it evolve to use that term complete. And the reason why we use that is, there's actually two strong reasons why we say neuropuncture is a complete neuroscience acupuncture system. The first one is when I was developing this system, I was applying it to orthopedic cases in pain management. I was applying it to infertility cases with women's health. And I realized that it was not just a system for infertility. It was not just an orthopedic system. And it wasn't just an electroacupuncture system. What I was creating was a neuroscience acupuncture system, and an acupuncture system that communicates with the nervous system and modulates the nervous system. And since the nervous system communicates with every system in the body and has some form of control or influence over almost every system of the body, then we not treat using neuropuncture once we understand properly the neurophysiology of the condition and how to apply proper electricity to modulate the nervous system. So complete in that sense that we can see pain and orthopedic cases, we see internal medicine cases, and we see mental health cases, and a wide range of almost anything that comes into the clinic these days. And I do get a lot of feedback from practitioners that only may have been in a lane of orthopedic and pain management until they trained with me. Now they're like, wow, now I'm treating PTSD. Now I'm treating insomnia. Now I'm treating infertility, when they were really only doing orthopedic acupuncture or sports medicine. So that's one reason why we name it a complete neuroscience acupuncture system. The other strong reason why we call it a complete neuroscience acupuncture system is that for the mere reason that it's not just a body system. We literally have a complete and separate, if wanted to be used that way, body system, a complete and separate auricular neuropuncture system, and a complete and separate neuropuncture scalp system. And all of those are all research supported, neuroscience evidence based, and they produce reproducible clinical outcomes. And using that neuroscience and applying it to the entire body gave us that application. Again, that's a complete neuroscience acupuncture system. And you could also combine scalp with auricular, auricular with body, or even all three of those in some of our more advanced prescriptions that we offer.
Amazing. So let's dive a little bit into it. When a patient comes into your clinic, can you give us the process that you do?
Yes, that's another great question. So another great, I think, impact that the neuropuncture system has on the practitioner is you're going to learn 21st century neuroscience biomedical terminology. Now, that's not Western terminology. That is global scientific language, right? So we're just learning the language of today to explain that. So first, we're going to use language, and we're going to be able to properly communicate with our patients and healthcare providers using the neuropuncture system. And then something that I always tell my practitioners is, I do not like to just give you the fish. I'm not just going to give you a prescription, because what if you're in the clinic and then I can't be there? Then I have to give you the tools so that you can catch your own fish. And what that leads to is the Trinity. And the Trinity is something that I created many, many years ago when I first started analyzing and really examining acupuncture, the classics, as well as the neuroscience of acupuncture. And this Trinity, what we say, gives all the practitioners that study with us the framework to apply the neurosciences and the electrical sciences to their acupuncture model or their practice in their clinic immediately. And what these three sections break down to, and that's why they're called Trinity. It's not a religious Trinity. I got some interesting faces when I first spoke in Israel about 10 years ago. The neuropuncture Trinity is called a Trinity because it has three very special components to it. The first one is the neuropuncture neurophysiological mechanisms. What that is simply the ABCs of acupuncture: the neuroanatomy, the neurochemistry, and the neurophysiology of how all acupuncture works. Because acupuncture is neuroscience, then any system is still a neuroscience acupuncture system. We just have to understand it that way. So whether you're using a I Ching system or the balance method or an auricular system or a scalp system or any other classical system, it's still neuroscience, and any of these mechanisms or a combination of them would be able to explain the transmission that's giving you the clinical outcome that you're observing based on the treatment that you're provided. And this also really helps us better understand our patient's condition, because we want to know the underlying neuro root pathology of that patient's condition. So then we can look at what mechanisms can we employ to actually modulate that tissue back into health. So the mechanisms gives us a lot of information, a lot of language, and a lot of confirmation of how acupuncture can be explained very clearly. Okay, like the back shoe points, distal needling, local needling, different types of stimulation that's going to affect the body in different ways. So that's all about the neuropuncture, neurophysiological mechanisms. Now, the treatment principles, again, I create this, so this is a system for you. This is not just point prescriptions. I don't even like giving out like treatment prescriptions without the practitioner training with me, because they're not really getting a real valid education or real valid amount of information to really apply it. You have to really learn the system. And the neuropuncture treatment principles, when you study these give the practitioners the ability to create our acunode selection or the acupoint prescription, right? The acunode selection, right? We don't like to have a lot of needles with a lot of electricity. We want to keep that very, very concise and very precise, so that stimulation is very accurate. Then, is there any needle technique that's special to get the best effect? And that comes from all the treatment principles. And then lastly, we have the neuropuncture electrical techniques. And then once we find out what the underlying neuro root condition is of the pathology, we figure out what treatment principle, what needle technique, and how to create the acunode to best address that underlying neuro root pathology. Then we figure out what's the best electrical dosage to neuromodulate, neurorehabilitate, or neuroregulate that pathological tissue back into health. And once you understand the Trinity, and this is the foundations of neuropuncture, this is not advanced work. This is something that's in the foundations that we have online that's very easily accessible. You just watch it over. I always say, repetition, mother of all skill. Watch them over and over. Take notes, write it down. Start to talk to your patients about this language. Start to understand and really comprehend the language. And then you're going to have better communication. And that is quintessential for any relationship, as you guys know. So there's the Trinity. That gives you guys the tools to create your own prescriptions and dosages and treatment plans. Now, we do have a clinical process. And Eli, you asked, if a patient comes in, how would I address that? Well, the first thing we're going to do is we're going to see if there's a medical diagnosis. If they do, that's great. Why? Well, if you don't really understand the medical diagnosis, I'll just look it up online real quick. What's the neuropathophysiology of the condition that they're coming to see me for? And I'll give you a great example why we do that. Restless leg syndrome. A lot of classical TCM practitioners may look at a patient that comes with restless leg syndrome and immediately look to the leg. The leg's restless. It's keeping the patient up at night. And because of that restlessness, they may look at maybe wind in the channels or phlegm in the pathways or liver blood not nourishing the muscles or tendons or even nerves of the leg. They may even say it's the liver blood not nourishing the nerves of the leg. Well, the reason why we don't do pattern differentiation is because that is a great example of how, unfortunately, nowadays, pattern differentiation may lead the practitioner to a little bit of almost a distraction. You're going to look at the leg, but if you really understand restless leg syndrome, if you take literally 2 minutes and just Google that, you'll find out that it has nothing to do with the leg, that it's actually a sleep disorder. So we have to regulate their sleep cycle, and you have to regulate and modulate the basal ganglion dopamine so that will actually quell the sensation in the brain that's letting them think that the leg is restless. And that's why we use the clinical process. So if a patient comes in with an unknown medical diagnosis, what medical diagnostics do we have at our fingertips that we can perform, like a physical exam or a neurological exam or an orthopedic exam or a palpation exam, to better assess the patient to find out what exactly is the root problem? Or is there an image? Is there an MRI? Is there a CT exam? Is there a PET scan or an X-ray? Or is there a lab test? Are we trying to check maybe neurotransmitters or adrenals or any specialty labs to see what is actually imbalanced in the patient? Then what we do when we find that underlining root neuropathology through the clinical assessment, then we're going to put that back into the Trinity. And that was this wonderful chart. And that's why better you understand this, the better you're going to be able to neuromodulate your patient's nervous system back into health for any case. And then that will give you your prescription and dosage and treatment plan. But in neuropuncture, we have, I think, over 100 prescriptions right now, research supported, that goes, again, covers the entire medical scope of pain, orthopedics, internal medicine, and mental health conditions. So we already have a lot of prescriptions. But if it's something rare, like maybe long COVID or a form of autism you're treating, right? Or a certain type of pain that's very rare, right? Well, then you're going to be able to have the tools to create your own prescriptions, your own dosages, which is the electrical parameters, and the best treatment plan based on gene expression and neuroplasticity to bring that patient back to homeostasis and correct their pathology and heal them. And then something that's really important too, we love neuroscience, but we also love the TCM classical holistic approach, right? We're not going to just take that nervous pathology and correct it and give it back to the patient, right? We want to correct everything in their patient's environment that might be even leading to that patient's pathology. That might be diet. It might be different modalities of gua sha. We do injections in America, so herbal injections, maybe locally, detoxes, functional medicine, herbal medicine, nutraceuticals, bone setting, lasers, liniments, jowls, poultices. We use everything in Chinese medicine, but when it comes to acupuncture, we're modulating the nervous system, and we're going to use electrical acupuncture to have those reproducible stimulation techniques that replicate hand techniques, and it's very controlled, and it's very, very direct. And then we put all that into the system. And then that's our patient. And that's our treatment plan.
Wow, that is a complete system to work and see your patient through.
Thank you. It's
Awesome.
it's always evolving, as you know, right, Eli? It's always evolving as well. So as more neuroscience comes out for the local effect, as we've been adding to it, we're going to keep evolving this, right? As more groundbreaking research comes out with biotechnology and electroneuromodulation, we're going to adopt it as much as we can to the neuropuncture system so that we always have a good footing in mainstream medicine. There's no reason why we shouldn't.
Okay. Thank you very much, Dr. Corradino.
Thank you, Eli. Looking forward to seeing you personally. Take care.